Welcome back to Being Talk About channel.
Hi, meet me again, Maria. Keep the spirit of spreading the benefits.
There are a lot of things people are talking about out there. As for us, let's start from here.
Happy hypoxia, or known as silent hypoxemia, is known as a condition of reduced oxygen levels in the body without any symptoms. However, this condition needs to be considered because it can have bad consequences, especially for people with COVID-19. Hypoxia is divided into several types based on the cause. Here are some types of hypoxia to be aware of.
1. General hypoxia.
Caused by a lack of oxygen in the blood flowing to the tissues.
2. Hypoxia anemia.
Occurs when the blood is unable to carry oxygen properly due to a lack of a healthy number of red blood cells.
3. Stagnation or circulation hypoxia.
Poor blood flow causes a lack of supply to the tissues. It can occur in one specific area or throughout the body.
4. Histiotoxic hypoxia.
Sufficient oxygen is taken in through the lungs and delivered to the tissues, but the body has difficulty using it.
5. Cytopathic hypoxia.
Oxygen can be used well by the tissues, but there is a higher than normal need for oxygen. Alright, I'll try to explain in more detail. General hypoxia. Common causes of general hypoxia are 1. Being in a high enough place where the oxygen level in the air is lower. 2. Shallow breathing or breathing that is too slow. 3. Pulmonary edema, which is when the lungs fill with fluid. 4. Ventilation-perfusion mismatch, which occurs when parts of the lungs get enough oxygen but no blood flow, or vice versa. 5. Asthma, a lung condition that makes breathing difficult. Hypoxia anemia. Iron deficiency anemia and chemotherapy-induced anemia can cause hypoxia. If left untreated, this condition can cause massive bleeding, external or internal, and carbon monoxide poisoning. Circulatory hypoxia. Causes of circulatory hypoxia or stagnation include 1. Edema, or tissue swelling, which can limit the ability of oxygen in the blood to reach the tissues. 2. Blood clots, which can block the flow of oxygen-carrying blood. 3. Shock, a life-threatening condition in which the body suddenly experiences a decrease in blood flow. 4. Stroke, which occurs when a blood clot blocks the flow of blood and oxygen to the brain. Histiotoxic hypoxia. This type of hypoxia can be caused by cyanide and exposure to other toxins. Cytopathic hypoxia. While cytopathic hypoxia is generally caused by sepsis or systemic inflammatory response syndrome, or SIRS, under normal conditions, oxygen levels in the blood oxygen saturation are in the range of 95100 or about 75100 mm hexagram. Oxygen levels in the blood that are below this limit result in a lack of oxygen in the body, causing hypoxemia or hypoxia conditions. If detected and treated too late, the condition of reduced oxygen in the blood can certainly endanger the life of the sufferer. Therefore, it is important for you to know the symptoms of happy hypoxia so that treatment can be carried out immediately. Symptoms of hypoxia are different for each sufferer. Symptoms of this condition can appear suddenly and worsen rapidly, acute, or develop slowly or chronic. There are some common symptoms of hypoxia, including symptoms of hypoxia can vary from person to person. However, hypoxia generally causes the following symptoms. 1. Confusion. 2. Fatigue. 3. Difficulty concentrating or loss of consciousness. 4. Slurred talk. 5. Hot flashes or a sudden feeling of heat. 6. Lack of coordination. 8. Fainting or dizziness. 9. Hard to breathe. 10. A tingling or warm sensation in the body. 11. Vision problems. 12. Fast heart rate and high blood pressure. 13. Quick breath. 14. Euphoria. 15. Headache. 16. A bluish tinge to the skin appears. In infants and young children, Symptoms of hypoxia can include weakness, lethargy, fussiness, irritability, unfocusedness, and restlessness. If not treated immediately, hypoxia can cause the patient to experience loss of consciousness, or even coma. Happy hypoxia syndrome is a condition of a person with low oxygen levels in the body but looks like a normal person. Normally, the oxygen level in a person's body is above 95%. Decreased oxygen levels in this condition do not make people difficult to breathe or do not feel breathless. However, under certain conditions, hypoxia can occur without any symptoms and is only detected when a person undergoes blood tests or oxygen saturation tests. This asymptomatic hypoxia condition is called silent hypoxia or happy hypoxia. Happy hypoxia has been reported to occur in some people with COVID-19. How to diagnose hypoxia? There are a number of tests that can be performed by health workers to detect hypoxia and its causes. Some of the tests that can be done are oximetry. This test is carried out using a sensor equipped. Sensors are then placed on the body to check the level of oxygen in the blood. Next, arterial blood gases. One type of blood test helps diagnose hypoxia and checks the amount of oxygen and carbon dioxide in the blood. Next, complete blood count. Blood tests that help diagnose causes of hypoxia such as anemia and signs of infection. Next, imaging test. X-rays or computed tomography CT scan can also help diagnose the cause of hypoxia, for example, lung problems or infections. Next, magnetic resonance imaging MRI. This type of imaging test can help diagnose brain-related causes of hypoxia such as a tumor, hemorrhage, or stroke. Electrocardiogram ECG, a non-invasive test that helps diagnose the cause of hypoxia and look for signs of heart damage or an irregular heartbeat.
Echocardiogram,
An ultrasound imaging test that helps diagnose the cause of hypoxia by checking how well the heart is functioning. The brain and heart are the organs most susceptible to the effects of hypoxia. Long-term mild hypoxia can cause serious damage. Research shows that doing so carries a risk of causing conditions such as growth and development of tumors and cancer, or cancer drug resistance, or worsening of the condition of the heart, or loss of kidney function. In severe cases, damage can begin within minutes of hypoxia. The following may occur as a result: seizures, or uncontrollable brain disorders that can cause involuntary movements and changes in consciousness, coma, prolonged period of unconsciousness, dead.
hypoxia treatment,
Handling steps in overcoming hypoxia, among others. Giving additional oxygen by using a hose or mask that is connected to an oxygen cylinder to help oxygen levels in the body return to normal. This is to reduce the risk of organ damage. Next, installation of a breathing apparatus or ventilator, which is connecting the respiratory tract to the ventilator machine, using a tube that is inserted from the throat until it passes through the vocal cords. And hyperbaric oxygen therapy for people with carbon monoxide poisoning. The patient will be put into a high-pressure hyperbaric chamber with pure oxygen.
hypoxia prevention,
Some efforts to prevent hypoxia including quit smoking, exercise regularly, avoid being a passive smoker, avoid asthma triggers and eat healthy food and stay active. That are the facts about what is happy hypoxia, causes, symptoms, prevention, and how to treat hypoxia. I hope the information I convey is useful for all of you. Don't forget to subscribe and comment. See you again with me, Maria, in the next useful video.